All right, thank you for having us. I'm just going to share the screen a minute. Okay, so my name is Kyla and I'm the Student Programs Coordinator for Operation Smiles Foundation in the United Arab Emirates. Our session today will be focused on removing social barriers to care, as well as looking at how Operation Smiles work is advancing Sustainable Development Goal 3. We estimate millions of children are unable to access appropriate medical care in 34 of the countries where we work. And because of this, being born with a cleft condition can be fatal. A cleft condition is a gap in the lip or the roof of the mouth that didn't close during the early stages of pregnancy. With 35 years of expertise, we provide life-saving reconstructive cleft surgeries and continue to increase our overall surgical safety, quality, and capacity worldwide. However, a lack of understanding, education, and empathy are still creating barriers to care. We depend on young leaders to step up and create innovative and disruptive solutions to reach and heal more children. So during this presentation, I will cover the issue and our Sustainable Development Goal focus, who we are and what we do, understanding cleft conditions, and what are the barriers to care. Our student programs ambassadors, Maryam and Lenora, will then take you through how students can help. If at any point you have any questions, please feel free to write them in the question and answer box, and we'll do our best to then try and answer them at the end of the session. So to start off with, I'm going to show a quick video that gives a general overview of what Operation Smile is. Sorry, we'll start that again. I'm obviously not sharing the audio.
Our vision underscores the passion and the commitment that we have for our patients. However, no one NGO, no one corporation or government can tackle the world's most pressing problems alone. It takes communication, partnerships, and collaboration on a global scale. After more than 35 years of working in some of the world's most challenging places, such as Madagascar or the DRC and so many more, we've learned that while conditions can be radically different from one country to the next, the virtue of trust is universal. And the only way to earn the trust is by building relationships with the people who are on the front line. And the reality is that children unite us all. We believe that investing in the children is the key to improving the health and the dignity of those who are most in need. It's not just through the work that we do on medical missions. All over the world, we provide training and educational opportunities that are elevating surgical standards and creating sustainable solutions in the areas where we work.
So here we have the 17 Sustainable Development Goals for the 2030 Agenda. As an organisation, Operation Smile works within Sustainable Development Goal 3, good health and well-being, ensuring healthy lives and promoting well-being for all at all ages. In particular, our work relates to these sub-goals. 3.2, end all preventable deaths under 5 years of age, with all countries aiming to reduce under 5 mortality to at least as low as 25 per 1,000 live births. 3.8, achieve universal health coverage, including financial risk protection and access to quality essential healthcare services. And 3.C, increase health financing and support health workforce in developing countries, substantially increasing recruitment, development, training and retention of health workforce. Operation Smile dreams of a world where no child suffers from a lack of access to safe surgery. But why do we focus on surgery? Well, a lack of access to safe surgery is a major problem that affects billions of people worldwide. It's an essential component of universal healthcare and a universal human right. But the truth is, more people die each year from the lack of access to safe surgery than from AIDS, tuberculosis, and malaria combined. But very few people are talking about surgery as a global health priority. Here are the facts that relate to the need for cleft care. There is currently a shortage of trained surgeons able to handle the growing need and backlog of cleft cases. Every 3 minutes, a child is born with a cleft condition. So by the time this session is finished, approximately 20 more children will have been born with this condition. Another way to look at this is 1 in 750 children globally are born with a cleft lip, a cleft palate, or both. Babies born with cleft conditions have a higher mortality rate due to difficulties with feeding, which can lead to aspiration or starvation. If they survive past their early years and the condition is still left untreated, they may face lifelong issues with eating and drinking, speech, socializing, and then also infections related to the ears, nose, and throat. So what do we mean by safe surgery? Providing patients with the highest quality of care based on the highest medical standards, no matter where they live. So who are we? Well, Operation Smile is an international medical charity specialized in cleft care with an active presence in more than 30 countries. Our network of more than 5,400 medical volunteers are from over 80 different countries and are dedicated to helping improve the health and lives of children. And who better to explain our history than the co-founders themselves, Dr. Bill and Kathy McGee.
It literally all started for Kath and I back in 1982. And to be quite honest with you, the two of us never knew what we were about to experience. We all went to the Philippines, to Naga City, and I can tell you it was transformational in our lives. I'm a surgeon and was used to seeing kids with cleft lips and cleft palates. Kath is a nurse with masters in human development and education, but we never, ever expected to see over 350 kids lined up to see us, all with gaping holes in their lips, roof of their mouth. They couldn't eat, they couldn't speak an intelligible word, and every one of those parents was tugging at our sleeves, begging us to take care of their child. I can tell you it was one of the most dramatic moments in our lives. All we could say to the people that we turned away was sorry. Maybe next year, but there was no next year. We could only take care of about 40 kids and had to watch as we sent away over 300 people. And all we could say was maybe next year, but we knew there was no next year. And that is what began Operation Smile. Reason leads to conclusions. It's emotion that leads to action. Now we're 38 years later. Now we have this organization that's in about 32, 33 countries actively. We've operated on over 300,000 kids, but there literally are still millions of children to take care of.
So beyond providing medical missions, Operation Smile looks to build long-term self-sufficiency in resource-poor environments. Training local medical professionals in our partner countries so that they are empowered to treat their local communities. To further support this, we also donate medical equipment and supplies, and are establishing year-round Cleft Care centres so that we can provide patient-centred treatment, so our patients don't have to wait until the next scheduled medical mission before they receive the care they need. Here you can see a representation of where Operation Smile has a presence around the world. The countries in orange represent our programme countries, where we organise medical missions. The purple represents our resource countries. They recruit medical volunteers to support our programme countries until they build their own base of trained and experienced medical volunteers, as well as raising the funds to aid medical missions as well. So Operation Smile was established and has its headquarters here in Norfolk, Virginia, the United States. And this here is the UAE, where I'm based. The foundation here was established in 2011, originally as a resource country. However, after opening, it became apparent that there was a need for Cleft Care support here as well. Although the indigenous population are covered by their government for Cleft Care, around 80 to 90% of the population in the UAE are expatriates who rely on local health insurance, which for the most part does not cover Cleft Care, leaving a gap in accessibility for those who cannot afford private care. So in 2017, the UAE also became a programme country. Our medical missions are generally a lot smaller, with between 8 to 20 patients over a weekend, than some of the other programme countries, such as Madagascar, Malawi, or the Philippines, who can treat around 100 patients over the course of a week. But what really makes our missions unique is that our patients generally represent an average of around 15 different nationalities. And now we move across to the Philippines, the country where it all started for Operation Smile. And in this next video, you'll be able to get a better understanding of the journeys that some of our patients take and what an Operation Smile medical mission looks like in the Philippines.
Meet JC. He was born with a cleft lip. JC and his family live in a village 90 minutes from the nearest hospital. For the past 3 years, his mother, Jackie, has been trying to get him surgery, but she has been repeatedly turned away due to JC's health. She's optimistic this time will be different. On the morning of the Operation Smile medical mission, she'll have to walk over 30 minutes to the nearest town center. Then she'll take a tricycle buggy ride for an hour to the hospital mission site so JC can have a comprehensive medical evaluation. During the screening process, over 150 kids will show up in hopes of getting an operation for their cleft condition. But not all of them will go home with a repaired cleft lip or cleft palate. JC's mom fears that if he doesn't get called today, he will go the rest of his life with a broken smile. Or worse, bullied, or with ongoing health problems. But today, JC's name was called. Operation Smile volunteers and staff go to great lengths to ensure that patients and their families have the best possible experience during the medical mission process. In any given week, throughout the year, there are as many as 600 compassionate volunteers in the field, both medical and non-medical, who selflessly give their time and skills to make this work possible. Thousands of kids all over the world waiting for someone to fix their smile.
So what is a cleft lip or a cleft palate? In the video, you'll have seen many examples of cleft lips, but this diagram shows you some of the different combinations of cleft conditions that can occur, from fully formed cleft lip and palate to an example of a bilateral cleft lip with full palate, otherwise known as complete cleft. In this video, it will further explain exactly what a cleft condition is, how it's formed, and why treatment is so important.
Like many people, you may be wondering, what is a cleft lip or cleft palate? How often does this happen and why? How can this be prevented? Or what can be done to help? A cleft is a gap in the mouth that didn't close during the early stages of pregnancy, and this kind of birth defect happens more often than you may realize. It is estimated that worldwide, a child is born every 3 minutes with a cleft, about 1 in 750 births. Sometimes a cleft condition can be easy to see because it's an opening in the lip. Sometimes it's harder to tell if someone has a cleft because it's an opening in the roof of their mouth, called the palate. There are many risk factors that can increase the likelihood of birth defects. While some causes are still unknown, genetics and family history, pre-existing medical conditions, poor nutrition, and exposure to harmful environmental substances can affect the healthy development of a baby. As a result, these factors could also be the cause of a baby born with a cleft lip or cleft palate. Depending on the type and severity, a cleft can create serious health issues if not corrected. Babies can have difficulty with feeding, which in some parts of the world can lead to malnutrition or even starvation. Ear infections can occur, and recurring ear infections can lead to hearing loss. Dental development can be affected. Speech and language development can also be impaired. Children may also suffer from bullying and social isolation. With surgery, a child suffering from a cleft lip or cleft palate can have a brand new, beautiful smile. In an ideal situation, a pediatrician and a plastic surgeon work with the child's parents soon after the child's birth to choose the best timing for surgery. Most surgeons agree that a cleft lip should be repaired by the time a baby is 3 months old, and that a cleft palate should be repaired between the ages of 12 and 18 months. For many families in developing countries, early surgery may not be an option due to lack of financial resources, qualified medical staff, and other factors. Since 1982, Operation Smile has been dedicated to finding these families around the world and providing them with surgery so they can live happy, healthy lives.
So the majority of people who lack access to safe surgical care are often the poorest in their countries, excluded to care due to low to no income, residing in remote locations far from surgical sites. Patients and their families may not know that this condition can be treated, or if they do know, they may not know where to go to receive help. And in some cases, a lack of trust in healthcare providers will also create a barrier that needs to be addressed through education and relationship building. So Operation Smile strives to help patients overcome the barriers to care, whether they are geographical, economic, or social, so that they are able to fully access and benefit from health services. So Operation Smile tries to at least address the economic barriers to care by providing our cleft surgeries free of charge to our patients. And we managed to do this thanks to our medical professionals donating their time, corporations providing equipment and supplies, and many other partners who provide their support or in-kind donations of essential items and services, so that we're able to bring the average cost of a surgery down to around 880 dirhams, or $240 or 150 pounds. And that's taking the total amount of expenses across a year and dividing it by the total number of surgeries we've provided across that duration. And this also includes the transportation of medical volunteers, additional resources, and cargo shipments of supplies and equipment. So when donors ask what it is that their funds are going towards, this is all that their funds are making happen. Now, as well as that, we're also starting to use funds to expand to include expenses for transport of patients to get to the mission site, as well as provide food and shelter while they're there, so that we're removing as many barriers as possible and making it easier for our patients to access care. I'm now going to introduce you to Cromeym. He's the patient recruitment coordinator in Ghana, and he's going to further explain some examples of social barriers that he encounters in Ghana.
I was involved in Operation Smile Ghana thanks to Emmanuel Kumaho. And then he told me that, well, they are having challenges in patient recruitment. And as a matter of fact, there is an assumption that maybe there are no patients in Ghana. Maybe the number of patients in Ghana are not many. So they're having difficulties in finding more patients. And I said, well, could it be that the patients are not there, or they are there, but the channel of using to find them is what is not clicking very well? So I said, well, if they are taking this thing away all because they are not finding patients, then let's get involved and make it happen. The challenge is lack of information. I believe that some of them do not know that it's possible for it to be fixed. So that might be a barrier. And then the fear factor. Immediately you mention the name operation, people get scared. Maybe I'm going to die. They do not know that it takes about 45 minutes to get the lip fixed. They are isolated, rejected, do not have confidence to come to public places. Society frowns on them. So you going there to tell them that, oh, Operation Smile Ghana is here to get your problem solved, they don't believe. And you know very well that there are so many things that goes on behind the scene to even find the patient. Not only finding the patient, convincing them to believe of what we offer as Operation Smile Ghana to come to the mission. And then when they come to the mission, then they see the reality. Then they realize that they are not the only one who is born with this deformity. For me, Operation Smile, I think, gives us the platform to show love to other people, to someone, somewhere, somehow, by putting in the little that you think you can do it well, because it goes a long way to save someone's life. Because you and I know very well what goes on with respect to this particular deformity in this country. The stigma is so bad, and I think it's a challenge that we all need to do our best to sensitize the general public. And I believe now, going forward, I think now as we're doing more surgeries, the sensitization is, going far.
So as Clement says, desensitization, education, advocacy, these are the key things that we need to focus on in order to be able to achieve our goal as Operation Smile, which is to be able to heal every child, every individual with a cleft condition. So students can make a difference, and here at Student Programs, we believe that the power of youth can be used to create a compassionate world through advocacy, education, leadership, and service. And we hope to ignite a spark that creates action, the spirit that drives volunteerism and the compassion that inspires you to become an impactful leader. So on that note, I'm going to pass across, just before then, I'm going to explain why students matter to us so much. Because you're essentially part of a chain reaction. You are what links our donors, inspires our donors to provide the funds that then enables our Operation Smile staff to organise medical missions, to send our medical volunteers on so that they can provide the surgeries that our patients need. But beyond that, our volunteers are the ones that spread the word, spread the education, so that eventually our patients get to hear about Operation Smile and get to understand that Operation Smile is here to help them, and that we can provide the treatment that they need. So I'm now going to pass you over to Maryam and Lenora, who are going to further explain exactly how students can help.
Hello, my name is Maryam, and I'm a student ambassador based in the UAE. And I'll be speaking to you about how students can help to further our cause. What sets Operation Smile apart from many other medical charities is the fact that students play a significant role in our activities. Our founders, Dr. Bill and Kathy McGee, took their 12-year-old daughter Bridget to a medical mission back in the earlier days of Operation Smile. And they immediately noticed the positive energy that students bring to a medical mission site. And that is how Operation Smile Student Programs was born. Under Student Programs, we host a wide variety of activities. And the best way for you to contribute as a student is to start your own school club. So school clubs are involved with fundraising, raising awareness, and most importantly, molding student ambassadors who can carry on the vision and mission of Operation Smile. In my school, for example, in the UAE, we've held bake sales, we've hosted workshops, run a plastic bag drive, among many other activities in support of Operation Smile. And what you see on screen are a few photos from some of the events held by school clubs in the UAE. So if you're interested in setting up your own school club, the best way to go about it would be to contact your local Operation Smile office, and they would be happy to help.
Hi everyone, my name is Lenora, and I've been a student volunteer for almost 5 years now. So what we would usually do during our time to fundraise and raise awareness would be through different activities such as teddy bear raffles or bake sales, as Maryam had mentioned before. But due to the current pandemic and the situation we have right now, we're unable to do that. And so us as students, we had to go outside our comfort zones, think outside the box, and find different ways to fundraise and raise awareness, which brings us to social media campaigns. So social media campaigns are one of the best ways to advocate for Operation Smile during the pandemic. So if you look to the left of the screen, you'll see a poster for an open mic event. So essentially, an open mic event would allow a lot more people to feel like they can relate to the cause because they're actively doing something to spread the word and spread the mission of Operation Smile. So through the open mic, you get a lot of people willing to participate, and then information and just the whole cause of awareness just slowly gets spread out from your circle to different people's circles and all the participants as well. If you look to the right of the screen, you'll see 38 questions with Operation Smile. So this is part of the campaign called Around the World with Operation Smile. So it's essentially like a playoff of 38 questions with Vogue, but it also helps celebrate 38 years of Operation Smile. So Around the World with Operation Smile allows us to basically interview different members of the Operation Smile community from different countries. It kind of helps us to show the extensive network that we have, as well as different viewpoints that other volunteers might have. So it allows us to just spread the word again and kind of just hear what people feel and what people are actually doing in their own countries. Yeah, so over here, you'll see two examples of our campaign. So at the top, you'll see Jess, who was a student volunteer in UAE, but she recently moved to Canada. So that's around the world with Operation Smile in Canada. And right below, you'll see Hugo, who is also a student volunteer from the Dominican Republic, both of whom are being interviewed by a student volunteer from the UAE. So another way for students to understand the outreach Operation Smile has and to just kind of collaborate with new minds and a lot more people and viewpoints and expressions is by attending an international student leadership conference. So this conference is usually a week long, and it helps us, it kind of helps you as a student understand how many people are actually involved with Operation Smile. Before Maryam and I had the chance to go on this conference, we thought like our reach would just reach to bake sales, teddy bear raffles, and all of that just within the UAE. But the second that we had the chance to go on this conference, we understood how many people were actually involved with Operation Smile and how many students actually related to the cause and contributed. So this conference, before the week, you have 2 to 3 days before where you have a mission training workshop. So this workshop trains you on different modules that you as a student has to educate the general families and the public at your international mission. So it teaches you different modules such as dental hygiene, CPR, nutrition, and so on. So your job as a student volunteer, is to go on these missions to educate all the families present there and to just share the knowledge that you have learned as your student.
So ISLCs are not the only way for students to come together. Many Operation Smile foundations across the globe host U-Lead conferences, which are essentially mini ISLCs that are held locally. In the UAE, we held our first U-Lead in November of last year, and the first ever virtual U-Lead, we held it this August. And U-Leads are a great way for students to interact with local and regional medical volunteers, patients, student volunteers, and staff members. One benefit of having gone online with our recent U-Lead was that we were able to attract international participation, with students joining us from places like Canada, Egypt, Vietnam, South Africa, and Latin America. And we hope to have even more international participants at our upcoming U-Lead in December. So to wrap it up, Operation Smile student programs has been coming up with innovative ways to make sure that we put smiles on the faces of our beautiful patients despite the pandemic. And I know I speak for all student volunteers when I say that Operation Smile has given us some of the most priceless moments in our lives. So we hope you'll join us and be part of the chain reaction.
Because us as students, we are the next generation of global healthcare supporters and advocates. We have the ability to actually make a change.
We have the power and responsibility to transform the world.
And that's exactly why the world needs us, students, to actually step up and create solutions and innovative ideas to actually change the world and help more children, which is exactly what we've been attempting to do with our online campaigns.
Just to round off, we have one more video just to recap on everything that we've been saying.
Our world faces a big problem. Millions of people in low and middle income countries are living with untreated cleft conditions. As many as 9 in 10 cannot access basic surgical care, and they endure years of bullying, social isolation, and severe health problems. Big problems demand big solutions. Through decades of experience in treating cleft, Operation Smile knows that surgery can turn suffering into optimism and hope. Our volunteers and staff provide treatments at medical missions and year-round care centers, bringing healing to patients, families, and communities. And our training and education elevate local surgical standards and entire health systems, strengthening our global network to reach more people earlier in their lives. That's how we're changing the world. But we can't do it without you. Will you help?
Okay, so are there any questions from anyone?
Well, I see a few questions in the chat, but if you would like to unmute your microphone, if you can, turn on your camera and feel free to ask our presenters a question directly.
Kyla, I think there's a question in the chat that you can answer. So it says, where can we find more information about student volunteering and events and workshops in the UAE?
In the UAE, well, to get in touch with us in the UAE, the best thing to do is to send us an email to studentprograms@operationsmileuae.ae. I actually forgot to show the last slide, which shows you all of our social media handles as well that you can follow too. There we go. So there's all our social media handles as well.
No, I'll just share one really brief story. One of our very first MUN Impact kind of case studies was an MUN delegate in DR Congo. And through her MUN involvement had learned a lot about public health issues. And so she became inspired and she started at Operation Smile club at her school. And so she was the president of this club. And every year for 2 to 3 years, she was the single largest individual raising the single largest amount of money for operations in DR Congo. And really because of her action and her initiative, she probably helped raise money for a good 1,500 operations over the course of the time between she was a sophomore and a senior. So that was a really creative way, that they did that at their school. They held a big gala. I have pictures, fancy dress galas, and they would reach out to the community and they raised a lot of money that way. So I share that because when we started MUN Impact and we were looking for MUN students who were taking action, this was one of the first stories that we found. So again, I hope if you're listening to this presentation, this is one of the reasons I was so excited that you could come, is because this is a great opportunity to get yourselves or your schools involved in supporting this really incredible work. So anyway, I'd love to see some of you featured on our blog for the great work that you're doing through MUN to advance SDG 3. So anyway, thank you. I know there are more questions, but I just wanted to share that story, and thank you again for being here.
It's great to hear. Okay, so let's have a look at some of the questions that are in the chat then. Maryam and Lenora, if you see a question before I do, just shout it out.
Yeah, I'll go ahead and ask what you guys do. First off, it's so impressive to see how much you guys are doing. It's such a meaningful thing to provide this, valuable medical service. So you guys maybe have the numbers on exactly how many kids you've helped thus far?
So globally, we've helped around 300,000. We provided 300,000 surgeries since 1982. But in the UAE itself, we've managed to do 4 local missions. We average about 12 patients per mission. Our very last one, which was this month? It was this month, August. We actually managed to do 8, which was amazing considering it was during the time of COVID. So slowly some of our other program countries are opening up to be able to do more missions again. Because obviously as soon as COVID started, everyone kind of had to take a back seat and reevaluate how this all works. So we actually managed to do our first mission since COVID, and we got 8 patients operated on. But we've also, as well as doing our local missions, the 4 local missions that we've done, we've also provided the funds for 15 different international missions around the world.
Kyla, I think there are 2 questions in the chat.
Okay.
What are the top 3 to 4 countries that you work in?
Say that again?
What are the top 3 to 4 countries that you work in?
Top 3 to 4? I don't know, we can narrow it down to that. We do a lot in Latin America. So there's a lot of countries in Latin America that we work. I know that Panama is one of the countries that are looking to open up again, you know, whilst we're still in COVID. Where else do we work? We work in Ghana a lot. So that's one of our African countries. We also work in Vietnam. And again, that's another of our countries that are opening up again and looking at ways to do things slightly differently during COVID.
Do we have a Smile Operations Center in Mexico?
We do. In fact, Maryam, Lenora, and I were supposed to actually go on an international mission to Mexico just before COVID struck, because obviously the girls here have trained to go on an international medical mission, and that was the mission that they were supposed to go on, but unfortunately we didn't quite make it.
Another question. Do you serve children in conflict zones? If so, how do you help these children gain access to surgery while ensuring safety from outside conflict and environment?
Okay, so this is where different NGOs are all needed to, you know, be able to help as many people as possible. So Operation Smile, as you heard through our presentation, focuses on cleft lip and cleft palate. That's where we specialize in, that's where we can create the most impact. But the other thing that we've got to think about is if we're entering conflict zones to do those surgeries, then there is always a potential that something could go really wrong and we could lose some of our medical volunteers. So it's weighing up the balance of where we can do the most good. And of course, there are other NGOs that are doing wonderful work, you know, risking their lives to help patients in conflict zones. But that's not an area that Operation Smile is working within. So at the moment, we focus on the areas that are stable, are safe for our medical volunteers to go to, and we're creating the most impact that we can in those areas. That's not to say that we don't look at patients who come from, you know, difficult areas and manage to get to our mission sites, you know, across the border in another country. We certainly will look at them.
Do you conduct any works in India?
Yes, we do. We have a big foundation in India. It's been running quite a long time. It was actually Mother Teresa that asked Operation Smile to come across to India after hearing about the work that they were doing in the Philippines, because India has quite a big population of children and adults with cleft conditions there as well.
Another one. Do you have any centers in Spain?
Say that one again.
Do you have any centers in Spain?
No, we don't have in Spain, but we do have in Italy. Italy has, I think they've expanded to 2, maybe 3 Smile houses now, which are essentially the year-round Cleft Care centres. But a little bit more than that because they actually accept patients from different countries, known as our World Care patients. So on occasion, during our medical missions, we will come across patients that we simply can't treat within the restrictions of our environment or the time that we have during that mission. So if we have enough funding, if we have the ability, sometimes we will take those patients and we will send them to Italy or some of our other worldwide care centres that take on World Care patients, and they'll receive treatment there.
Somebody asks, how has Operation Smile adapted to the pandemic?
That's kind of a country by country thing. So everyone has kind of had to reevaluate how we do things. So whether it is scaling down our missions, for example, in the UAE, although our missions were already small, we've gone even smaller so that we can make sure that we've got social distancing, you know, that we can get all the procedures in place. So we ended up managing to operate on 8 patients here. I know that in India, they're now starting to look at how they can do screenings online so that, you know, we don't necessarily have to have the patients physically in front of us. We can see them online so that we can kind of filter through who's the best candidates for surgery, you know, and try and do things that way as well. So it's very much a case-by-case basis.
Another question. What is the current status of Operation Smile in the middle of this pandemic?
I'm not entirely sure what that question means. We're still going ahead. We're still trying to help as many people as we can. We did take a pause for a while so that we could reevaluate because obviously our normal mission had to be adapted and that applied to all of our countries. So we are still going, we are still fundraising, and headquarters have done a huge campaign just recently. They're just finishing it up just now of reevaluating exactly how we can help our patients and, you know, change our methods of providing surgeries and coping with reaching out to our patients in line with what we're dealing with nowadays.
How did Operation Smile come about?
Say that one more time.
How did Operation Smile start?
So it was Dr. Bill and Kathy McGee. They were living in the United States in Norfolk, Virginia. As he said in his video, Dr. Bill McGee was a surgeon, still is a surgeon, and his wife Kathy was a nurse. And they were invited to go to a medical mission in the Philippines. And as Dr. Bill McGee will say himself, it wasn't really for any altruistic reasons. He really went there just to learn more about cleft lip and cleft palate and to be able to gain more experience. But obviously when they got there and there were so many children that had heard about this one-off mission, they were inundated with all of these patients that they just couldn't treat everyone. So I think there was around 300, but they only managed to operate on around 40 during the week that they were there. And of course, at the end of the mission, some of the parents of the patients that didn't receive the surgery tugged at their arms and said, look, if you come back next year or the year after or the year after that, we're still going to be here. We're still going to be needing your help. So the McGees just couldn't let that sit. They couldn't walk away knowing that that was the only time that operation, that mission was going to happen. So when they went back to the States, they then started recruiting their friends to help raise funds. They started recruiting their colleagues. And that's how Operation Smile started.